I'm Dr. Fair with Back to Action Chiropractic. I'm here today to talk to you about a condition that keeps showing up in my office. That's lateral tracking of the patella, or Chondromalacia patella. What this is you have your knee that kind of comes down like this, your shin and your femur, and as you walk, you kind of get this motion. Now your kneecap kind of sits right in between the two. It has a nice little groove that it sits in. When you have an imbalance in the muscle, either too tight on one side or the other side is not firing correctly because it's too weak, that patella ends up rotating out and kind of sliding off to the side. Now behind the patella is going to be a little area of cartilage, and that cartilage starts to get damaged and tends to cause a lot of pain. What you find with chondromalacia patella tends to be just generalized knee pain or pain right at the patella itself, or the tendons coming into and off of the kneecap there. When you have pain there, that's a good sign of chondromalacia patella. Now, there's a couple ways to rehab it, and we're going to go over some of those exercises. But one of the big things as well is a good stretch. So I'm going to bring my assistant out here, and we're going to kind of go over a stretch. Now the best thing to use is a belt, just a normal pants belt or something like that, as long as it's nice and long. Today we're going to be using a TheraBand. What we're going to do is we're going to wrap it, just kind of tie it off. And then what you're going to want to do, I'm going to have you turn this way. You're going to roll it up over the opposite shoulder. So go ahead and bring that leg up, and just like that. And then nice, good stretch in there. Great. And what you're wanting to feel is a stretch right on the front side there. Now, when you pull it across the opposite shoulder, it kind of pulls the leg in, which is fine. This is what you want. You don't want to stretch where your knee's coming out the opposite way. So this will get a nice, good stretch across the quads there, as well as a little bit on the IT band. And this is a great stretch. If you want to take that one step further, what I recommend is using a foam roller. We'll kind of walk you through that technique as well. Let's have you come right over here. So you lay down the foam roller, and you're going to foam roll right across your quads like you normally would. Except with this, you want to get a real good stretch of that quad. So bring that up nice and tight there. That way it's already stretched, it's already engaged, and when you foam roll across it, go ahead and foam roll. Then you're rolling across the muscle that's already stretched and creates a greater stretch across there. And that'll really help to loosen up and break up that tight muscle there. Good job, thank you. Now the next thing is, we're going to come back in here. We're going to go through a few rehab exercises. I'm going to have you lay back. Perfect. Let me get this off you. Now the first one, the most ideal ball would be like a kickball. That has some squish to it. Some people use a soccer ball. Today we're using a volleyball. It's got a little bit of air let out, so it's a little bit more squishy. So for this first exercise, let's have you lift one knee up. We'll say this is the knee that's bad. And what you're going to end up doing is rotating the foot in and then extending that leg up. Just like that. And what this does is it really focuses on this medial muscle right here. And this tends to be the weaker muscle when you have chondromalacia patella. This outside muscle tends to be overly tight and ends up pulling that patella off to the side. So by strengthening this, you're bringing it back to neutral. You feeling that? Yeah. So another thing that you can do while you're here, just kind of as a neurological thing, you can actually tap the muscle, and this kind of brings recognition to that area, and this helps that muscle to start to fire a little bit more correctly. So just tapping it like that's it's a good thing. All right. Now, the next stage of this is the harder version of this. I'm going to have you move over to this chair next to you. Right there, same thing. Here we're going to lock the ball in right there between the legs above the knee. Okay? And then go ahead and turn your feet in, both feet. Extend, we'll say this is the hurt knee this time. extend this leg out. And this is the more advanced version of that one. So that one you're going to get a good burn. This one you're going to get a great burn. Nice and tight. Do a full extension, bringing it all the way back. And the big thing here is make sure you're squeezing in. You're going to be squeezing that ball with your legs, and that helps engage the entire medial aspect of that leg there. All right? And then the last one is we're going to be right over here, and it's going to be the style of a lunge. So what we do is we put a straight line here on the wall, a little tape line, and what you want to do is have the patient line up right in front of it. That knee is going to be straight in front, and they're going to do a lunge, a backwards lunge. So just sliding that leg back and bringing it back. So a few things that you're going to be looking for here is keeping this leg nice and center with that line. You don't want it deviating from one side to another. And the other is making sure that hip stays nice and level there. So to show you kind of from the front, we're going to use this as our line here. So if some people don't want to put tape on their wall, you can just use a pole, something like that. Kind of level it out and bring it down. So you want to make sure that you keep that leg nice and in line. There we go. And keep that hip straight. Great. And those are the 3 best exercises you can do. Thank you so much. Those are the 3 best exercises you can do to help rehab that area and really strengthen that medial muscle, as well as stretching out that opposite side. The best way that I use to describe this to patients is with this rubber band. I think about it as shooting like a water balloon or a ball or something. If I had it right here in the middle and it was nice and even, it'd be coming up straight. And that's what you want your kneecap to do, is track nice and straight. If you move it off to the side, all of a sudden you have one area that's overly stretched and the other side that's contracted too much. And then it starts to fire wrong. And it's the same concept as if you go either way. It's just not going to fire straight. So when you get that nice and even, so stretching that one side and strengthening the other, you get a nice even pull to create a nice even motion. So like I said, this is Dr. Fair with Back to Action Chiropractic. Make sure you come in. If you've got knee pain, come in and get checked, and we'll do our best to help you out. Thanks.